There are a certain number of patients that years after surgery may find that that they've lost some ground. They may have regained some weight, and many of these patients have fallen out of the routine that we had set them on. So when a patient comes in years after surgery and wants to get back on track, wants to get back to the goals that they had achieved early after surgery, we try to accommodate those patients, because we have a part of our practice that focuses on this. First of all, we'll discuss with the patient what their shortcomings may have been lately, whether it's nutritionally, whether it's from an exercise standpoint, and we reintroduce the patients back to our team approach. And often that it is quite effective. Clearly patients who continue to follow up and stay with the team approach that we provide do better in the long run. So we try to encourage patients to reacquaint themselves with those elements. Now, we also can look at the patient's anatomy to see if perhaps there is something that we can do with their pouch surgically that may increase the restriction that either they had less of to begin with or that they may have lost over time. So there are certain revisional surgeries that we perform, and there are a few different options that we can offer to a patient and even tailor to a patient's needs depending on the anatomy that we find when we investigate the patient.